begin a little bit more philosophy, what are the needs of our patient? Our patients are not in need of a new implant system. Neither are they in need of a new implant surface. My patients definitely do not need a new prosthetic connection. They don't need any surgical instruments or any kind of improvement done by the companies. It's not for my patients on those specific technicals. My patients, or your patients, or patients all over the world need solutions. And we should try to focus on solutions at the thing that we market. It's not an implant design, it's a solution. We're trying to make a better life for all our patients. And the opening speeches this morning was really motivating because they were all focused on the patient experience. If the solution is, I'm going to replace your tooth, it often starts with the problem, I'm losing a tooth. My patients would traditionally then ask me the 4 questions on how are you going to do it, what does it cost, when you're going to do it, and how much time do I have as a patient to invest in your dental chair to have the result that I would like, namely a fixed tooth or fixed teeth, which I can smile and chew with. And you can do this in multiple ways, and you can always try to do the best for your patients, but there's always some goals that we need to achieve. And we will never, no matter what I present to you this afternoon, we will never try to challenge the primary goals. And the primary goals of implant therapy is successful treatment outcome, high predictability, good long-term stability, and low complication rate. That does not prohibit us, and it does not limit us to search for the secondary goals, which are more patient-oriented. More interesting for the patient is that, can we do this with the fewest possible number of surgery? Can we do it with low pain and morbidity? Can we make it shorten the healing time? And can we make a shorter overall treatment time?